Cindy Moore. I think like that name suits me because I want to be more extreme, more glamorous. I just want more of everything. I want my boobs a lot bigger, my lips a lot bigger, and my waist a lot smaller. I like to work out naked. When you're working out, little bits are curling round, your belly's wobbling and stuff. So as I'm working out, I can see what I don't like. It just gives me a little bit more motivation. So I just have a strange way of doing things. When I was young, I wore trainers, tracksuit, my hair tied back with my one glove, thinking I was Michael Jackson. I think I went through a stage that I thought was a cowgirl. So I used to always wear the hat and the shorts and the boots. As I got older, I just started to look at Dolly Parton, Pamela Anderson, and I just thought, like, where's my boobs? I have none. I was completely flat-chested, and that is when I decided just to revamp my image. When I first got my boobs done, they was just very perky. I didn't need to wear a bra, they just stood up. After I had my daughter and my son, I was really big and I just felt ugly, fat, I just felt disgusting. When I started losing weight, instead of buying myself a cake at the shop, I go on eBay and get a little outfit. The more I toned up, then I started to wear littler outfits, and I started posting them on Instagram and getting a bit of a following. All the mums at school always give me dirty looks, probably think, how is she doing this? Turning up at like 8 o'clock in the morning, really over the top, dolled up. Makeup, hair, red lips. I have a very unconventional way of doing my makeup, so I have like a normal ink pen that I just use to draw my eyebrows on. I think I would rather go outside naked than I would without any makeup or my lipstick on. I want to talk to the doctors regarding my lips because I've got like quite a lump on one side from getting my lips injected every couple of weeks. I want my lips just as big as they can possibly go without popping off my face. That would be brilliant. I'm hoping the doctors will be able to give me my dream boobs. I would like the size of the 2 now as 1 to bring them up to 2,000 cc's. I'd love to have my top ribs removed just to give me more of a tiny frame. That really fake look is the look that I want to have. I just like to look like a bimbo, but that's not who I am inside. I think on the inside you've got to know who you are, be strong, be intelligent, but there's no harm in looking like a bimbo while you're doing that.
I want to be sexy.
We have a patient named Cindy who comes to us from across the pond. So Cindy is a lip filler enthusiast.
Okay. See that.
And I think she wants to talk to us about possibly permanent solutions. And she obviously has some problems with her breasts.
Can you please send in Cindy?
Hi.
Cindy, how are you?
Hiya, you okay? Hiya.
Hi, Cindy.
Nice
How
to
are
meet
you?
you.
You okay? Hiya. I've brought the doctors a hand-painted bag.
Oh my God, look at that.
Me with my Dolly Parton boobs. And I purposely made my boobs extra big on the bag so they can see my vision.
You look a little like an alien.
I think you're right.
He looks like he,
my head's
take
going
me
out
to
like
your
that.
leader.
I may look like an alien, Terry, but you look like the lizard man from The Shape of Water.
That is so.
That's great. Thank you very much.
Thank you very much.
Okay, so you obviously work out big time.
Yes,
What do you do for a living?
fitness instructor.
So you train her?
Yeah.
So I lost quite a lot of weight, so now like I want to focus on like toning up. But I do like training naked.
So wait. You train naked?
Yeah.
Why do you like to train naked?
Gives me motivation to push through.
Were you naked
No,
also?
I wasn't naked.
You're fully clothed.
Yeah, fully clothed, yeah.
How do you stay professional when she's naked and she's
Very,
training?
very hard work.
Right.
Did that lead to something else right after the workout?
You're making you sweat.
I love it.
I'm roasted.
So
I
here,
bet
then
he
you
doesn't even
gotta.
sweat like this when he works out, does he?
I thought I was here to talk about Cindy, not me sweating.
Obviously, you're here to see us regarding some issues you've had with some procedures. Did you lose weight before you had the cosmetic surgery or after?
After
Okay, how many cc's do you have inside?
1,000.
1,000's big.
I still put chicken fillets in because I like them bigger. I want my boobs a lot bigger. I couldn't get a wheelbarrow to carry them around.
They're droopy and they're smaller than you'd like them to be.
Yep.
Tell us what's going on with your lips.
They've got like lumps in at the moment, but I just cover it with loads of lipstick.
You have filler in there, right?
Yeah.
You want something more permanent?
Yeah, because it's painful. Like, the moment she puts the needle in, my eyes are watering, and I get them done so regular. I think I'm going to end up with like lumps all over if I don't sort them out.
So tell us what your goals are in terms of cosmetic changes you want to make from this point forward.
Bigger lips, bigger boobs. I would love like top rib taken out so her waist looks tinier.
Would you really do that?
Yeah. I just want to look like a glamorous me.
I thought this was a joke. I think the ribs are quite nice. Helps protect things inside.
So let me ask you, you know, we have patients come in and there's two varieties of them. One has complications that they want our help with, and then there's another variety who just wants to go more, and blow it up and become almost animated characters. Is that you?
Yeah. I would like to be an animated character.
You would?
I think that's why I wear so much makeup. I just like that over-the-top kind of look. You know, when I wipe it all off, I just look about 12 and not really sexy anymore.
It's nice to see you at this stage before you've gone to the next level, because hopefully we can give you some information that may help you and what we think maybe you should consider not doing. Okay?
Okay, first of all, why don't you point out these little irregularities that you're talking about?
Quite a big one there.
Oh, you got like a little open wound there.
Yeah.
So there's anything inside this or no?
A little bit.
Cindy's lips are getting irritated. I can see these little micro cuts. That most likely is from the repeat injections of filler. She has to be very careful because once she crosses that line, she can ruin her lips completely.
Who does your filler?
It's a woman from Manchester.
Okay, is she a nurse or?
No.
Some non-medical person?
Yeah.
Yeah.
Does she do it in a facility or does she come to your
At my
house?
house.
Is that legal?
Well, the other question is, what is it?
I can't really go out and see a doctor to get my lips done because I don't leave my house without a full face of makeup, and that includes my red lips. So she's just convenient. She comes around to my house, so it's a win-win.
The body is very smart, and it knows when it doesn't like something, and your body doesn't like that.
You can actually kill the skin on your upper lip.
You ever heard the expression, don't try this at home, that they say on some TV shows? Don't do this at home.
And the problem with lip implants, whether they're made out of something called PTFE or silicone, they're never great. They either move or they shrink, or usually, even if you put them in the best place possible, they start to lift up and go above the lip. So the first thing we're going to tell you is implants, we're not going to recommend for you.
It actually makes me really depressed to think about it.
Okay, let's talk about your breasts, okay? First of all, I'm curious whether you're on top of the muscle or under the muscle. So put your hands here and push down, flex. Yeah, you're on top of the muscle. Okay, for sure. And then secondly, your breast implants are up here, and your breast tissue is essentially hanging off them. You have what we call classic dissociation. So the procedure to correct that is a breast lift. If you put a giant implant in there, it won't work. It only works if you have a little bit of droopiness. Then it's like putting a big foot in a small sock, and it will fill up the smaller sock. Your sock is too big and too droopy. I don't care how big a foot you put in there, it's always gonna be a droopy sock. Trust me on this. I can do a lift for you, but in fact, it'd probably be better if you went a little smaller.
I don't want to go smaller, I want to go bigger, so no, it's definitely something that I definitely wouldn't consider.
Any large increases in size, any tight lifts are gonna risk losing the nipple, losing sensation, losing your breasts. It's just a disaster. Because I have news for you. Bigger is not always better. Is there any way we could convince you just to not do all this gigantic surgery that you might be planning on doing?
I love big boobs, and to have them smaller, I won't feel the same.
Sometimes the best plastic surgery is no plastic surgery at all. And if Cindy continues expanding their size, she's going to meet a major surgical disaster. And there may be no going back from that.
Well, can I take some chicken fillets to stuff in my bra?
If we can prevent you from having any of the surgery by giving you some of those, we'll give you the whole chicken coop.